Hi, I'm Dr. Margaret Richards Frankel, and welcome to From the Dentist's Mouth. Today I'd like to talk about adult dental education. Primarily, I'd like to talk to you about the importance of visiting the dentist, and just because nothing hurts in your mouth doesn't mean there aren't serious issues that could be occurring. Let's start about talking about coming to the dentist. So adults, at minimum, we should be at the dentist twice a year. Oftentimes we see the dentist more frequently than that, and that depends on the rate of cavities, how often you get cavities, or if you have something we call gum disease or periodontal disease. If you fall into either of those categories, chances are you're going to be at the dentist more than twice a year. Now, at home, when and how often we brush is also important at keeping both gum disease and cavities at bay so that when you do come to the dentist, we're addressing fewer issues. When to brush. I always recommend to my patients that we brush at least twice a day, both morning after we eat breakfast, and I tell my patients, please wait 30 minutes after eating to brush. So after breakfast, we wait 30 minutes and then we brush our teeth. We also include flossing in that. Floss at the same time as brushing. I also recommend that we floss first to pull any extra debris away from the tooth and finish up that process with the toothbrush. Then I also recommend that we brush again before we go to bed, flossing as well. We floss first and then we brush our teeth before we go to sleep. Saliva actually plays an important role in fighting cavities and periodontal disease or gum disease, and saliva flow decreases at night. So we want to make sure that we are absolutely brushing before we go to bed, because as we know now, saliva is going to decrease, and saliva helps protect against cavities. And if we have food in our teeth, we're going to feed the bacteria that cause cavities. So brushing before we go to bed as well. Now, it's not just about home hygiene, although that is very important. It is also about our diet and our eating habits. Now, our diet should not consist of simple carbohydrates. It's not healthy for us. It can also promote common diseases such as diabetes, and it also contributes to tooth decay. So I always recommend to my patients that we are eating 3 healthy meals a day. We're not snacking throughout the day. That has the ability to increase your cavity rate. How does that happen? Well, we're feeding the bacteria in our mouths food. Just like it's food for us, it's food for bacteria. So if we're snacking, we're constantly feeding that bacteria. We're giving them the strength basically to be able to eat through the tooth and cause a cavity. Another common contributor to both periodontal disease and to cavity formation is smoking. I recommend to my patients that they attempt to quit. Periodontal disease and caries are worsened by smoking because smoking can reduce saliva flow. It can also change the tissues in the mouth, and those both can contribute to periodontal disease and caries or cavities. I'd like to talk to you about proper flossing techniques. I prefer the good old flat-fashioned rope floss, the kind that you clip, you wrap around your fingers, and then you're able to insert into your gums. If you're not able to use that type of floss due to dexterity issues, I do think that the dental flossers are okay. Many of my patients do use those. They're the ones on the stick with the added bit of floss onto it. And my one concern about those is that they don't properly hug the teeth while you're flossing. But if you think you're able to floss well with those, then absolutely I do recommend. Thank you for spending a little time with us at Richards Frankel Dentistry today. Remember, it's so important to visit us at least twice a year for your hygiene visits. You can call or make an appointment with us online today.